Think 431, Presentation and Discussion of Study Findings. The course learning outcomes are integrate knowledge from other disciplines when utilizing the research process and critically analyze research findings. The weekly learning outcomes include examine two broad classifications of statistics, discuss the purposes of descriptive and inferential statistics, describe appropriate use for descriptive and inferential statistics, describe methods to present research findings, and critique selected quantitative research articles. Presentation of factual findings. Most research reports present findings in both a narrative form and in tables. Narrative findings should be clearly and concisely presented in the text. In qualitative studies, you usually find narrative presentations. They generally contain direct quotes from participants and then discuss patterns and themes found in the data. In quantitative studies, the narrative presentation should present data that support or fail to support each study hypothesis. The statistical test that was used, the test results, degrees of freedom, and the probability value should always be included in the presentation of findings. Tables are a means of organizing data so they may be more easily understood and interpreted. Hypothesis testing results should be placed in a table or a footnote, and a footnote should be added that provides the test results, degrees of freedom, and the probability level. Tables should contain columns and rows. The term figure is used to indicate any type of visual presentation other than a table. Figures may include graphs, diagrams, line drawings, and photographs. They are particularly useful in presenting demographic data about the subjects. The discussion section of a study report allows the researcher to make interpretations of the findings. It is a much more subjective section of a research report than the presentation of the findings. The researcher discusses aspects of the results. The researcher may also reports the study limitations. The presentation of inferential statistics used to test a hypothesis is the most important aspect of findings in studies in which hypotheses have been formulated. Research hypotheses predict study results based on theoretical framework or on previous research studies. The results of the hypothesis testing fall into one of three categories. The null hypothesis is not rejected, the null hypothesis is rejected, and the research hypothesis is supported. And lastly, the null hypothesis is rejected and the results are in the opposite direction from the prediction of the research hypothesis. When the study results are congruent with the study prediction found in the research hypothesis, it provides empirical support for this hypothesis. The investigator asserts with a degree of certainty that the results were not due to chance. Even when the null hypothesis is not rejected, negative results may be as important as positive results. It is important to be objective when considering negative results and then explain the negative results. Discovery of results that are in the opposite direction of the study prediction is not supportive of the study's theoretical framework. These results may also be incongruent with previous research results. For an investigator faced with this dilemma, the best thing that can be done is to try to make some sense out of the findings and give some tentative explanations for the results. Recommendations may then be made for further research based on the explanations. Statistical significance means that the null hypothesis has been rejected and that the differences found between groups on the variable of interest or the correlations found between two variables are not likely to be a chance occurrence. This significance may not be clinically important. Clinical significance means that the findings may be useful in the clinical settings with patients. Ideally, study findings are both statistically and clinically significant. Study conclusions show that what knowledge has been gained by the study and are also an attempt to generalize the findings. They are based on the study problem, purpose, hypothesis, and theoretical framework. The researcher emphasizes what the study has demonstrated in these areas, but remains somewhat conservative in drawing conclusions from the findings. The findings of a study are concrete and tied into the specific data of the study, whereas the conclusions are more abstract and use more general terms. The implications of a study are the shoulds, or what needs to happen next. They are the conceivable changes that are based on the conclusions of the study. Whether more research is called for to further verify the study results, no change is needed, or changes need to be made based on study conclusions. The last section of every research report should contain recommendations for further research. This section proposes replication of the study or a new study in which the present study limitations are considered. The researcher may suggest an extension of the present study. Replication of a study involves carrying out a similar study to the one that was previously done. Only minor changes are made from the previous study. Common recommendations that are made concerning limitations are alteration in the sample, alteration in the instrument, control of variables, and change in methodology. After completing a study, the investigator should be in a good position to determine the next steps that needs to be taken to examine the subject area under consideration. Extensions of the research study suggest future research that is based on findings of a particular study, the findings of previous research, and the current state of the theoretical framework that was used in the study. The investigator must be very objective when presenting the findings of a study. However, in discussing the study results, the researcher has an opportunity to interject some subjective interpretation of the data. The discussion section of a research report should talk about the findings of each hypothesis that was tested or each research question that was answered. The findings should be interpreted in relation to the study framework and previous literature on the topic. Study conclusions should be presented, and implications for nursing practice, nursing education, and nursing research should be indicated. Recommendations for replication or extension of a study should be suggested.